Did you know that 1 in 8 men will be diagnosed with prostate cancer in their lifetime? With prostate health affecting millions of men worldwide, what you eat plays a crucial role in either protecting or damaging this vital organ. In this video, we explore the 7 most harmful foods for your prostate. If you're looking to safeguard your prostate and avoid the potential dangers lurking in your diet, make sure you watch till the end to discover which foods you should avoid at all costs. Number 1. Red meat. Red meat, including beef, pork, and lamb, can have a significant negative impact on prostate health, particularly when consumed in large quantities. One of the main concerns with red meat is its high content of saturated fats, which are known to promote inflammation in the body. Chronic inflammation is a major risk factor for prostate-related conditions, including benign prostatic hyperplasia and prostate cancer. Elevated inflammation damages prostate cells and disrupts normal cellular processes, creating an environment conducive to disease progression. Another key issue with red meat is the way it is prepared. High-temperature cooking methods such as grilling, broiling, or frying produce harmful compounds called heterocyclic amines and polycyclic aromatic hydrocarbons. These compounds have been shown to cause DNA damage in cells, including those in the prostate, increasing the risk of cancer development. Studies have found that men who consume a diet high in red meat, particularly well-done or charred meat, have a higher likelihood of developing aggressive prostate cancer. When consuming red meat, using gentle cooking methods like stewing or slow cooking can reduce the formation of harmful compounds. Number 2. Spicy foods. Spicy foods, such as those seasoned with chili peppers, hot sauces, or strong spices, can cause irritation in the urinary tract and worsen symptoms associated with prostate issues like benign prostatic hyperplasia or prostatitis. Spicy foods contain compounds like capsaicin, which can stimulate bladder activity, leading to frequent or urgent urination. This can be particularly uncomfortable for men already experiencing urinary problems due to an enlarged prostate or inflammation. For individuals with prostatitis, a condition where the prostate is inflamed, spicy foods can act as a trigger, increasing discomfort or pain. Capsaicin and other spicy components can irritate the delicate lining of the bladder and prostate, worsening symptoms like burning sensations during urination or pelvic pain. While capsaicin has anti-inflammatory properties in other contexts, for prostate-related issues, moderation is key to avoiding unnecessary aggravation. If spicy food is a staple in your diet, you don't have to eliminate it entirely, but consider milder options. For instance, replacing hot chili peppers with anti-inflammatory spices like turmeric, ginger, or cinnamon can add flavor without irritating your urinary tract. Number 3. Processed meats. Processed meats, such as bacon, sausages, hot dogs, deli meats, and salami, are some of the most harmful foods for prostate health. These meats are often preserved through smoking, curing, or adding chemical preservatives like nitrates and nitrites, which are known to have carcinogenic effects. When consumed, these preservatives can convert into nitrosamines in the body, compounds that have been linked to an increased risk of various cancers, including prostate cancer. Processed meats are also high in sodium and unhealthy fats, both of which can worsen inflammation and lead to hormonal imbalances. Chronic inflammation caused by these foods is a major contributor to prostate enlargement and can create an environment favorable to cancer development. Additionally, the high salt content in processed meats can lead to fluid retention, which may worsen urinary symptoms often associated with prostate enlargement, such as increased urgency and difficulty urinating. To support prostate health, it's best to eliminate or significantly reduce processed meats in your diet. Instead, choose fresh, unprocessed protein sources like lean chicken, turkey, fish, or plant-based options such as lentils and chickpeas. Before we proceed to the next harmful food for your prostate, be sure to hit the subscribe button. Number 4. Dairy products. Dairy products such as milk, cheese, yogurt, and butter can negatively impact prostate health, particularly when consumed in excess. They are high in saturated fats and certain hormones that may contribute to inflammation and hormonal imbalances in the body. Chronic inflammation is a key factor in prostate enlargement and has been linked to an increased risk of prostate cancer. One of the primary concerns with dairy is its effect on insulin-like growth factor 1, a hormone that promotes cell growth. Studies have shown that high levels of insulin-like growth factor 1 in the body can stimulate the growth of prostate cells, potentially encouraging the development of cancerous cells. Additionally, dairy contains naturally occurring estrogen-like compounds, which may further disrupt hormonal balance and exacerbate prostate issues. For men concerned about their prostate health, it's beneficial to reduce or replace dairy with plant-based alternatives such as almond, soy, or oat milk, which are often fortified with calcium and vitamin D. These options provide similar nutritional benefits without the inflammatory effects of dairy. Number 5, fried foods. Fried foods, including items like French fries, fried chicken, onion rings, and donuts, are among the most harmful for prostate health due to their high content of unhealthy fats, particularly trans fats and saturated fats. These fats are known to promote chronic inflammation, a significant risk factor for prostate enlargement and prostate cancer. Inflammation damages prostate cells over time, creating an environment that can contribute to the development and progression of prostate-related conditions. Additionally, the high-heat cooking methods used in frying produce harmful compounds called advanced glycation end products. These compounds form when proteins or fats are exposed to high temperatures, and they can contribute to oxidative stress and inflammation in the body. They have been linked to tissue damage in the prostate, further increasing the risk of malignancy. The unhealthy oils used in frying, especially when reused repeatedly in restaurants or fast food chains, also introduce carcinogenic compounds that may harm prostate cells. Reducing fried food intake and replacing it with healthier cooking methods such as baking, steaming, grilling, or air frying can significantly reduce exposure to these harmful compounds. Number 6, canned foods. Canned foods, while convenient and long-lasting, can pose significant risks to prostate health due to their high levels of sodium and the presence of harmful chemicals like bisphenol A. Many canned goods, including soups, vegetables, and even tomatoes, are packaged in cans lined with BPA, a synthetic compound that mimics estrogen in the body. This hormonal disruption can negatively impact prostate health, potentially contributing to prostate enlargement and increasing the risk of prostate cancer. Additionally, many canned foods are heavily salted for preservation, with some containing more than half the recommended daily intake of sodium in a single serving. Excessive sodium can lead to fluid retention, raising blood pressure and worsening urinary symptoms associated with prostate enlargement, such as frequent urination and difficulty emptying the bladder. High salt consumption is also linked to inflammation, which can exacerbate prostate issues and harm overall health. To protect prostate health, opt for fresh or frozen alternatives instead of canned foods whenever possible. If canned foods are unavoidable, look for BPA-free packaging and choose low-sodium options to minimize exposure to harmful chemicals and excess salt. Rinsing canned foods like beans or vegetables before consumption can also help reduce sodium content. Number 7, refined grains. Refined grains such as white bread, white rice, pastries, and regular pasta are grains that have been stripped of their outer bran and germ during processing. This removes most of their fiber, vitamins, and minerals, leaving a calorie-dense but nutrient-poor food product. These refined grains are quickly broken down into sugar by the body, leading to rapid spikes in blood sugar levels and subsequent insulin resistance. Insulin resistance is a known risk factor for prostate cancer and can exacerbate inflammation, which negatively impacts prostate health. The lack of fiber in refined grains also contributes to poor digestion and irregular bowel movements, which can increase pressure on the prostate, particularly in men already dealing with an enlarged prostate. Fiber plays a crucial role in regulating blood sugar levels, reducing inflammation, and supporting gut health, all of which indirectly benefit prostate function. By consuming a diet rich in refined grains, you're missing out on these protective benefits and increasing the likelihood of metabolic issues that may harm the prostate. Switching to whole grains such as brown rice, quinoa, whole grain bread, and oats can provide the nutrients and fiber needed to support a healthy prostate. Maintaining a prostate-friendly diet involves minimizing foods that promote inflammation, disrupt hormonal balance, or contribute to weight gain. By avoiding these 7 foods and making healthier dietary choices, you can take proactive steps to protect your prostate health. If you found this video helpful, please give it a thumbs up. Thank you for watching, and for more amazing videos, subscribe to our channel.